coordination program is about getting people home from the hospital safely and with all the resources they need. So the goals are to keep patients from having to go back to the hospital for expensive readmissions and to keep them out of the emergency room as much as possible. Since we started our hospital-to-home program about 2 years ago with registered nurses who work with patients upon discharge, we've been able to decrease our patients' readmission rate by 20%. We've also been able to decrease their emergency room visits by 20%. If we were going to summarize, would be identifying patients who are at risk, connecting them with a registered nurse who will help them stay as healthy as possible, and then the third piece is connecting them to their health home, which will be one of our ElRio locations. So it kind of embraces, puts a nice soft pillow around patients at high risk to keep them healthy.
What we do as care coordinators could be something very, very small to us. It takes, half an hour of our time coordinating care, but to him, it just meant the world.
But literally, at the moment that he realized that we weren't getting the care that we should be getting, he acted at that time, and he took it upon himself. He literally put me on his back, and he said, "Come on, let's go. We're gonna take you."
We eliminate the barrier just to say, no, here's your appointment. I'm going to help you get better. I'm going to help you get there.
When patients were first introduced to the model of patient-centered medical home or team-based care, I think they were confused with having multiple providers, but I think once we all explained our roles and the fact that we were actually all there to advocate for the patient and to really help them address different problems has really increased the level of satisfaction for patients.
It's organized and it's professional, and I appreciate it very much.
It's who they are. It's not, okay, I'm going to say it, it's not that someone just coming to work and going above and beyond the call of duty. It's much more than that.
We need to empower the patient with education and knowledge and keep doing that until they understand it. We let the patient lead, but we give them the GPS and the navigating tools that allows them to move between all these levels of care as smoothly and efficiently as possible. We're not going to leave you on your own. We're going to help you and guide you through that process.
Well, as we look futuristically at our healthcare system, we hope there will be sources of funding through the healthcare system to pay for these services. But today, these are services that aren't reimbursed by Medicare or Medicaid. We're moving in that direction, but in the short term, our needs are around funding those registered nurses to serve as care managers for our patients.
Had we not come here, I probably still wouldn't know what my future is going to be like. Right now we know, and it's because of ElRio. It's because of the angels here, my primary and Kathy, that made that happen.
We will stay true to our mission of providing high-quality primary health care and empowering people to live healthy lives. We thank you for your caring and generous support. ElRio Community Health Center. Your health is our passion.